Hello, guys. Hope you're all doing well. My name is Damani Johnson, and I'm here to talk about the questions that I answered for the case study, A Family Divided. So, to start off, the first question asks the judgment of fertility should be a conclusion of a communications process, not a beginning. How do you propose beginning the communication? The other part of the question asks who should be present, what information should be shared, what alternatives are on the table, and then lastly, what is your goal in participating in the discussion? So I kind of answered the first one in this below the first question, and it was short and sweet. Honestly, I will honestly try and be as empathetic as possible. I agree that the judgment should be the concluding statement in this case. I feel like in that moment when you ask a wife or a husband or anybody that has someone that they care about in the hospital with a serious condition, I don't think starting the conversation with "What do you want to do in this case" is the right way to start. So that was my answer for that one. And on the next slide, I have the answers to the first set of questions. As far as who should be in the room, his wife and adult children should definitely be present, especially if they're his next of kin legally. In most cases, when you have someone in the hospital, and you have to make a decision whether it's like life support or a ventilator or anything like that, you have to have the people there who are legally binding to them. So if someone's wife is in the hospital, then the husband or wife or their partner should be able to make that decision. And if there's no significant other, then children and so on and so forth. Number two, as far as what information should be shared, I believe it's important to know all information regarding his condition. It'll help the family understand the severity of his condition, as well as just understanding, every aspect of this. So when they make a decision, it's important to know every factual piece of information as far as his condition and what it looks like in the future for him as well as the family. Number three, as far as the alternatives, from what I've interpreted, there aren't many alternatives in this case. Due to the patient's condition, he had the option to give him the feeding tube, or pretty much, honestly, don't place him on any secondary medical machines, which, like I said, could be a feeding tube, could be a ventilator, respirator, anything like that. And then lastly, my goal as far as participating in the discussion would be just, I would just want to be as level-headed as possible, as well as attempting to choose the best method of care for the patient. I have a record of being honestly level-headed in any major situation, so that would be my goal, just to kind of be, the middleman in the situation and to have everyone try to think, as clearly as possible. And then next, I have this second set of questions. So it asks, the family is divided over whether their husband and father should be placed on the feeding tube. Consider and discuss the following statements. The effectiveness of the feeding tube is a clinical matter. The benefits of the feeding tube for the patient depend on the patient's wishes and quality of life, which the patient or the patient's surrogate and family must determine. And then lastly, the burdens the treatment feeding tube imposes are a consideration for both parties. The feeding tube, as for my answers for that, the feeding tube usually is a very helpful tool in nursing a patient back to health. However, in his case, it could possibly make his condition worse. He has aspiration, which can worsen his condition. And if anybody doesn't know, aspiration is when any liquid or food that you swallow goes down the wrong way, as people call it. In his case, that could be in the lungs or in his airway, which can ultimately stop him from breathing or him choking. And in this case, him already having the stroke and not being able to communicate makes it 10 times worse. And then the story, it also says his cerebral cortex was badly damaged, which explained to the staff that him being able to swallow, wouldn't be a possibility. And he was also he was in and out of consciousness. Only thing he could say when asked the question is yes or no. So just to kind of put that in perspective a little bit. So, of course, there are a few concluding questions that was stated in the case. So, number one says, role play the discussion, express your assumptions and loyalties, and listen attentively to the other speakers. And since I didn't have any other speakers, I just chose to kind of put myself in their shoes. And then number two, evaluate the role playing experience. Did it affect your view of the case? If yes, how will you advise the family and the healthcare providers? If not, what is to be done now? And then number three asks, how would this case have been different if the attending physician had been the one asking for a consultation? So these are my concluding answers. So number one, I have been in this role before. It isn't the best feeling. However, you try and do what's best for your loved one. In that case, you must put your personal feelings on the shelf because it's important that the person gets the best options and alternatives. I went through this, last year of 2021, and it's a very weird position to be in because you want to keep that person here. You want to make sure you do everything you can, of course, like anybody would. But then sometimes you have to, kind of be a little bit more realistic and choose the alternative that's best for them in the moment. Secondly, as far as did it affect my view of the case, it did affect my view of the case because I've actually dealt with something like this in my personal life. It's very hard to be in a place where it feels like you're playing God with someone's life. As far as advising the family, I would advise the family to think heavily about his well-being and how their decision could affect him overall, and understanding like how severe his condition is. Like the guy couldn't even form, proper sentences. So that's also something to keep in mind. And then lastly, it would have been different in that case had the physician had been the one making the decision. And I said maybe they would have wanted to help to make the right decision just as much as the family, in case the physician was in the family shoes. And I also didn't think about that if the physician was the one making the decision, since they have the medical backing and the education to do so, they would probably, choose the option that they think is best, which in the case, it was stated that, they believe that placing him on the feeding tube just wouldn't be the ideal thing because of how severe his, condition is. It was a very interesting case, and I thank you all for listening, and I hope you all have a wonderful rest of your semester. Thank you.